Hello everyone, I am Dr. Hamza Al-Ashwah and we have a new case in our playlist, the examination frame related to MRCS examinations. We have today the hand case, okay? After introducing the room, I am going to be systematized or be systematic frame, okay? To be in your mind all the time, okay? After introducing the room, you have to wash your hands, introduce yourself, and confirm the patient details, and also explain the examination and gain the consent, and also ask for the exposure and offering the chaplain. This is what? This is orthopedic case. So you have to look and feel and move and doing what? Examine special test. So we have another page, okay? You have to do some special tests, and finally you thank the patient and wash your hands and go to present your case. We have to discuss by details, okay? Firstly, wash your hands, okay, and introduce yourself as we say. Good morning, good afternoon. My name is Dr. Hamza. I'm one of the surgical doctors. Could you please confirm your name and age? Okay, and explain the examinations. Today I have been asked to examine your both hands, which including what? Look and feel and move and doing what? Some special test. Was that okay with you to gain the consent and ask for the exposure? Could you please expose your both hands above your elbow? Okay, and the examiner with you as a chaperone. You have to start the inspection, the look. Look, okay, inspect the hands, inspect the hand, inspect the dorsum, inspect the palm, for scarring, swelling, deformity, skin nail changes, muscle wasting, scars, Dupuytren contraction, thinner and hypothinner wasting, okay? And also inspect the elbow. For what? For psoriatic plaque and also rheumatoid nodules, okay? After that, you have to go to feel the patient. But before you start, I remember you have to ask about the pain. Don't forget to, before you start to touch the patient, you have to ask about the pain. Do you feel any pain at the moment? Okay. If it's okay, it's done. Okay. After that, you have to assess the temperature. Okay. On the palm. Okay. Proximal to distal. Okay. After that, you have to feel or palpate the radial and the ulnar pulses, and also the thinner and the hypothinner, and feel or palpate palmar thickness. Okay. By this way, you will not forget one. Start by palm and sensation of the hand, medial and the ulnar, and now you will return to the dorsum surface by palpate the radial sensations. After that, you will again assess the temperature on the dorsum and squeeze the metacarpopharyngeal, and doing bimanual palpate the joints of the hand, metacarpopharyngeal, proximal interpharyngeal, distal interpharyngeal, carpometacarpal pharyngeal. Okay, to assess the tenderness, to assess, suggest, and also palpate the wrist joints, assess symmetry, tenderness, and the anatomical snuff box for scaphoid fracture. Okay, and the radial and the ulnar styloid process. Okay, and also the ulnar border of each arm to the elbow. Okay, to assess any rheumatoid nodules or psoriatic plaque. After that, go for the movements. finger extension and flexion. Start by this. After this, wrist extension, wrist flexion, passive wrist flexion and extension, and going to assess the nerves by movements. The radial one, finger extension against resistance. Ulnar one, finger abduction against resistance. Medial nerve, thumb abduction against resistance. Okay, we have to continue. Okay, after that, test for flexor digitorum profundus. This is for helping for Arabic people. Okay, and test for flexor digitorum superficialis, and also doing the thumb movements. This will help Arabic peoples. Okay, and the function of the hand, power grip, pincer grip. Observe the patient picking up small objects and doing some special tests for median nerve, for ulnar nerve, for median nerve, the Tinel's test and the Fallon test help Arabic people. The ulnar nerve, from signs, tunnels for ulnar nerve, and also doing modified Trocken test. And don't forget to examine the neck by doing ask a patient for flexion, extension, lateral rotation of the neck if there is pain or tenderness. After this, you have to thank the patient for let me examine you. Do you need any help to get dressed? And wash your hands and go to present your case and doing small discussion about what you see in your case with the examiner. By this systematized frame, you will collect more marks. You have to see videos only for the tests, for specific in this frame, specific points in this frame. But you have to save this frame in your brain all the time and see a videos to the point in this frame. By this way, you will collect more marks, I promise you. Thanks for your listening. With you, Dr. Hamza.